We are live. There we go.
Live.
Does not appear to be updating on my end of YouTube.
It'll take a second. It's going to take a second.
Not appear to be updating on my end of YouTube.
It'll take a second.
Okay, so let's do this. Okay, I think we can get started now. Thank you all for being here. Well, for being there in your homes and for tuning in tonight. I'm Cara Spencer, the Alderman of the 20th Ward in the City of St. Louis and Chairman of the Health and Human Services Committee of the St. Louis Board of Aldermen. As we all know, what we are experiencing with COVID-19 is unprecedented. There's no roadmap. The world has not done this before, not on this scale. There are many unknowns and we all have questions. When will we get back to normal? How much will this cost us? How many people will be affected and how many lives will be lost? We don't know the answers to all these questions, but there are many things we do know. And the more informed we are, the faster and safer we will get through this and the less damage we will sustain from COVID-19 on our community. We're here tonight to hear from local experts and to hear from you. We have a very informed panel who will provide updates and answer your questions. We've taken several questions in advance, but we will also be taking them live in the comments section of this YouTube channel. As you hopefully know by now, the most important thing you can do is to stay home. So thank you for taking time while you're at home tonight to tune in with us. We're going to start with Dr. Echols. Dr. Fredrick Echols is the director of the Department of Health for the City of St. Louis, and he is the first medical doctor to serve in this position since 2007. Prior to becoming our health director, he served as the director of communicable diseases, vector and veterinary programs for the St. Louis County Department of Public Health, and prior to that, he was chief of communicable diseases for the Illinois Department of Public Health and has served as a physician in the U.S. Navy. Dr. Echols, thank you for being here tonight. I'd like to turn it over to you to give us an update from the City of St. Louis.
Thank you so much for providing us with this platform to share accurate information to the public and dispel some of the myths and misinformation that may be circulating in our community. So the City of St. Louis Department of Health is at the forefront of the COVID-19 response for the region, but we aren't doing it alone. So early on, back in January, we started really effectively planning for our response. And so knowing that we couldn't do it alone, we brought other agencies to the table, our neighboring local health departments from across the Mississippi River, from the Illinois, east side of Illinois, as well as other first responder agencies. So the fire department, SLMPD, as well as emergency operations staff that operate the Lambert Airport, which is a major thoroughfare for the St. Louis region. Over time, we've experienced similar trends that other jurisdictions have experienced. So, similar to what we see with influenza each year, we have no activity, and then we have sporadic activity, then we have local activity, then regional activity. And so we've kind of gone through those phases during this COVID-19 response. And we typically go through those different phases for all respiratory illnesses because they are difficult to manage. And a lot of people have difficulty adhering to those simple preventive measures that we give them each and every year, essentially. And so one of the challenges with our COVID-19 response is to get people to actually change their behavior. So how do we do that effectively? And so in some ways, we have to do that by implementing or executing executive orders. There's been 5 orders that have been executed by the city of St. Louis, some of which includes community mitigation strategies, which are strategies that have shown to be effective in slowing the spread of communicable diseases in communities. The most recent executive order is our stay-at-home order, which is really a very a tough order because there's economic impact as well as unintended consequences that come along with that. And so when we were thinking about whether or not to actually execute this particular order, there was a lot of thought that went into it, but at the ultimate, the deciding factor for us is our end goal, and our end goal is to stop the spread of COVID-19 and save and protect lives in the city of St. Louis and the St. Louis region. And so, based on the trends that we were seeing from an epidemiology standpoint, that strategy was absolutely necessary to be implemented at that time. And most people see that as some people can see that as us impinging on their rights. But what we have to do is look at the system as a whole. And so when you have cases of respiratory illness like COVID-19, it can spread very rapidly in our community after it's introduced. And so that's what we saw. Initially, we had 1 case, and then over the last few days, we've had upwards of 40 cases a day, which means that it's circulating in our community. There's substantial community spread, which places every component of our health system at risk. Whether you're looking at the hospital systems, the public health systems, everything is interconnected, even other government agencies that aren't deemed to be health-related agencies, or agencies that don't provide health-related services. But health is a component of every single facet of government. And so, again, community mitigation strategies were implemented to protect the system, at least to soften the blow, if you will, because what you'll see if those strategies aren't implemented, we'll have our healthcare workers will be the healthcare workforce will be impacted. And so when you remove individuals or you from the healthcare workforce, you limit the system, the region's ability to actually provide medical care for individuals that need it. And so if those individuals aren't able to receive medical services, you have worsening health outcomes for those other things that we monitor every single year, whether it's diabetes, heart disease, et cetera. But then that also places a larger burden on the health departments because we have to conduct contact tracing for every case that's detected or reported to us. And contact tracing is a very intense activity, but it's required. So what we typically do is identify everyone that's deemed to be a close contact to a confirmed case. We contact them, enroll them in our self-monitoring program, which requires them to be essentially self-quarantined for 14 days, at least 14 days. Individuals that do not develop symptoms during that time can return to their normal activities, but individuals that develop symptoms at the time, they have to be tested for COVID-19. And if they screen positive, their self-isolation period is actually extended until they're asymptomatic for a certain number of days. And so, again, these community mitigation strategies are really important to protect protect our workforce, our healthcare workforce, our health systems, and our public health system. So, one of the things that we also have to do is make sure we're educating the community on how they can properly protect themselves. And so we've used several media outlets, traditional and non-traditional, to reach individuals across the community. Not everyone has access to social media, not everyone has access to phones. And so we've been using some grassroots organizations to actually get papers, whether it's FAQs for COVID-19, out into the community so people will know what COVID-19 actually is and how they can, and the simple measures that they can implement to protect themselves, their family, and the community at large.
Thank you, Dr. Echols. Dr. Echols plays a really vital role here by driving a lot of the policy within our city government. Now I'd like to turn to our other 2 panelists who are driving policy from outside of city government, from a little bit broader perspective. First, I'd like to start with Dr. Timothy McBride. Dr. McBride is a self-described troublemaker, a health policy expert and leading health economist who's helping to shape the national agenda and access to healthcare, health economics, and other health issues. He's a professor in the Brown School and co-director of the Center for Health Economics and Policy at Washington University's Institute for Public Health. He served as the first associate dean for public health at Washington University, and is responsible for developing the university's new Master of Public Health program, leading the program to accreditation in 2012, and currently sits on the board of the St. Louis City Health Board, and has served as chair of the State of Missouri's MoHealthNet Oversight Committee, advising Missouri's Medicaid program. Dr. McBride, thank you for joining us tonight.
Thank you so much, Cara, for calling this meeting and on this important event. And I commend you and Mayor Cruson and Dr. Echols and their team at the Department of Health for their leadership during this this pandemic. And, I'll just make a few comments because I'd like to get to our questions. I'd like to point out this is a 100-year event, really. This is something we haven't seen in this country since the 1918 flu, which actually St. Louis is famous for dealing with. We could talk about that later if we want, but this is the most significant challenge I've seen in my lifetime since 9/11. And that our region has seen, I think, since Ferguson. Now we all face, now we're all about ready to face this, and I think we're about ready to face a major recession that I think is greater than the Great Recession. So I think we're facing this challenge of the Great Pandemic, I think, but also we're about ready to be hit, or we're being hit right now with a Great Recession. And so a few of the comments that I'd like to make are from my perspective on the Board of Health, which I have the privilege of being the vice chair of. And so I think the role that we play is from trying to play to help Dr. Echols and his great staff in providing advice and guidance on the role that they play. But the important point to make is that we're not responsible for the day-to-day operation and management of public health in the city, but we try to help guide them in making the policy decisions and accreditation and things like that. But in a situation like this, Dr. Echols and his staff are dealing with this on a day-to-day, minute-to-minute basis, and that's our real challenge. But we're trying to really help Jason, myself, others in the region in trying to be all hands on deck to try to help the City Board of Health. And I think everybody listening should know that that's happening. And the final set of comments I want to make is we have a unique region with, I think, some significant challenges as well as some great strengths. On the strength side, I'll say that we have some really great medical systems. So we have great medical systems at SLU, at WashU, at SSM, and Mercy, and other places that may not be entirely clear to people, but they're already deployed to deal with this situation. And they've been working on this for weeks. And they've been planning for this pandemic, and they've been working with Dr. Echols and the county and surrounding counties and with the state. And we have public health schools, really great public health schools and programs at St. Louis University and Washington University and the medical school that have been providing our academic expertise. And the City Department of Health has been reaching out to get that academic expertise. And one of the things that I know our board has is some academic partnerships with the St. Louis Department of Health through WashU, through SLU, through UMSL, their nursing school, and so on. So there's been a coordinated effort that I really have appreciated watching play out. Dr. Echols spoke to that, that the city has developed with the county, with Sam Page and Spring Schmidt and Emily Doucette in the county health department. And frankly, I will make the comment that I think we're leading the state effort in battling this pandemic. And we can talk about that later too if we want. On the challenges side, I'll just sort of throw out a few things that I worry a little bit about. I worry about affordability and access. I worry about our low-income persons in our community. I worry about the lack of Medicaid expansion and the fact that, that I think we put in place some things both at the federal level to make testing free. Hopefully that's happening, but I worry about if people get treated, are they going to be able to afford it? Especially when the recession hits in full force, if it's already happening, because the people that are going to be hit by the recession are going to be people that already have low incomes. I worry about access to prevention and treatment. I really appreciate what I've seen in the last week or so about creating a testing site and north side of the city. So that's great. And I think if the more we can do around that and improve messaging, I know that Dr. Echols and his staff have done a lot of great messaging. I worry about health disparities and social justice, and I'm sure Jason's going to talk some about that as well. So I think some of the things I just talked about, we just have to think a lot about that. And I worry about is our state leadership on board with what we're doing here in the city and county. But just I'll finish by just saying that I think we've built significant. I think you should know that we've built a significant communication between our health systems, between our academic leadership, our political leadership, our public health departments, and our state, actually. So don't think that that's not happening. That is happening behind the scenes. And Cara and the Board of Aldermen, the mayor, and Dr. Echols are leading that effort. So I appreciate that. That's my comments for now.
Thank you, Dr. McBride. I'd like to turn over now to Dr. Jason Purnell, who is an associate professor in the Brown School, and he's the director of Health Equity Works at Washington University in St. Louis. Dr. Purnell, his team, and many partners have been instrumental in convening cross-sector stakeholders for strategic response to disparities in health, education, and economic status. He is currently serving as a technical specialist advising St. Louis County on response to the COVID-19 pandemic and is facilitating efforts on a regional level to respond to the social needs of the most vulnerable populations in our community. Dr. Purnell?
Thank you, Cara. Thank you for inviting me to be part of this conversation. I want to echo Tim's gratitude to Dr. Echols and all of the public health professionals who are responding, I know, around the clock to this unfolding crisis, and would reiterate the unprecedented nature of the challenge that we're facing. Commend the leadership in the city in terms of taking strong and decisive action to try and mitigate the impact of this crisis. But as Tim alluded to, my focus has been on the most vulnerable populations and the social needs that have already emerged as a result of this pandemic. I started off, kind of raised my hand and reached out to Spring Schmidt at the County Health Department after the first case in the county was identified, and asked how I could help. And my first question to her was really about what are we doing around a coordinated response to the social needs of the most vulnerable populations. And when we're talking about the most vulnerable populations in the context of this particular crisis, we're talking about older adults, we're talking about disabled individuals, we're talking about low-income individuals, we're talking about the unhoused, we're talking about young children. And very often we're talking about older adults taking care of young children in circumstances that were dire before this crisis, and that have only been exacerbated by this crisis. So it became clear very soon to me and a number of other leaders that it was critical to have the kind of regional response that both Dr. McBride and Dr. Echols have pointed to. We can't allow ourselves to be siloed. We can't allow ourselves to sit in our own corners on this, because all hands really are needed on deck. And with that in mind, several leaders have come together to form what we're calling the COVID-19 Regional Response Team, which is has coverage, geographic coverage in St. Charles County, St. Louis County, the city of St. Louis on the Missouri side, St. Clair and Madison County on the Illinois side. And there are really 4 goals of this regional response team: to identify the top needs and priorities of vulnerable populations. So when we talk about equity, the vulnerable populations here are at the center of these conversations. They're not an afterthought. They're not where we put our leftover resources. This is the centerpiece of all of the conversations that we're having with multiple stakeholders across the region. The second goal is to share effective solutions and approaches, which have to be coordinated solutions and approaches. The third is to deploy critical resources in an efficient and coordinated manner. And we're very happy to have the partnership of the St. Louis Community Foundation and its Regional Response Fund, which has raised well over $1.5 million already, and which I hope continues to get support from throughout the region. And finally, the goal is to highlight the needs and opportunities for funders in the broader community so that we have a good sense and a grasp of where those emerging needs are so we can direct the resources in the proper way. So it's been rapid development of this particular team, and we've tried to identify real leaders in the region in terms of response to these kinds of critical situations. And in doing so, we're also making sure that these efforts are complementary to the existing disaster and emergency response efforts that are underway and for which there is already infrastructure. But what I'll say is, this is not the typical disaster response. This is not a fire somewhere in an isolated part of the region. This is not a tornado that just hit down in one part of the region. This is not a situation where we can call neighboring emergency personnel to come in. Everything is on fire. So when everything is on fire, we have to have a different kind of approach. And so the attempt to complement the traditional disaster response has to do with, in most disasters, we're not talking about closing down all K through 12 education. We're not talking about closing down all of higher education. We're not talking about closing down all businesses. So this really does require us to think in creative ways and to really respond to a fluid, changing situation. But as I said, always at the center of the work that's being done. And I have to say, there are dedicated individuals who are working themselves around the clock, truly. And I think the community needs to know this, trying to get resources to the people that I'm talking about. We're in constant communication about how we can deliver those resources. But this is a time for St. Louis to come together. This is a time for us to respond as a region in every corner of our region, because the needs are significant. But I often say that there are vast reservoirs of goodwill in the St. Louis region, and I think we can respond to this. We can meet this challenge.
I think we'll turn now to some of the questions that we're getting right now live on YouTube. One of the first questions that came in is about documents to distribute to the community to educate folks. Dr. Purnell, I know you're working on a regional kind of messaging. Do you want to speak to that first?
There's been some support from the Missouri Foundation for Health, and Dr. Echols is a partner on that, as is with the City Health Department. I'm helping the County Health Department, Department of Public Health, in a coordinated campaign. The Missouri Foundation for Health is supporting that. Our third partner is the Regional Health Commission. And again, our focus there is getting credible information to the most vulnerable populations through multiple channels. So We've got very able partners in vector communications who are working on a comprehensive strategy, and we're already in the process of approving those materials to go out, as Dr. Echols said, to the most vulnerable parts of our region.
I know for me, representing a very small piece of the entire region, we put together a 20th Ward sort of South City resource guide, and we just got it out today. Of course, we didn't have as nearly the amount of information to include, but some of us are putting little local ones. If that would be helpful to Shauna, who asked the question, I'd share that, and we'll certainly get this regional guide out when it becomes available. FAQs published. This is another question that was just asked. I'm not sure that we have one. Dr. Echols, does the city have an FAQ? I know we're pointing people to the website. Can you speak on that just briefly?
Yes, so that was one of the first things that we did, because we wanted to make sure that the community had information that they could understand. So we actually simplified the language a little bit so that individuals could understand what the preventive measures actually meant, as well as what COVID-19 really is and what that means for the city of St. Louis. And so that document has been posted on the City of St. Louis government website for the last almost 3 weeks now. And so we always direct individuals to our website so that they can not only access the FAQ that's available, but we also have links to other sites such as the CDC and some agencies that specialize in information for maternal, child, and adolescent health.
That's great, and we can post links to those after this is completed. Messaging specifically for young adults 18 to 24. Dr. Echols, or can anybody speak to specific age demographics in that?
Sure. So I think one of the challenges that we actually encountered during the second week of our response was information that had circulated prior to that point, which is that young individuals may not be prone to getting COVID-19. And so with that being the first thing that they heard, they really latched onto that and have not really been adhering to a lot of the preventive measures and the guideline that we set forth. And so really educating them and informing them that everyone, regardless of their age, race, ethnicity, socioeconomic status, can get COVID-19 if they're exposed. So we're doing a lot of work in that area to again, make sure that the youth understand that they're at risk just like the elderly are. And so some of the partners that have helped us reach that audience are STL TV, as well as some of the radio stations such as 95.5, 104.1, and some of the live streaming stations that youth typically listen to.
And
Dr. Purnell?
I would just add that social distancing and the other mitigation strategies aren't just about avoiding infection for oneself. It's also about avoiding infecting others. So even if someone is young and relatively healthy and has mild or no symptoms, they can still transmit this disease. And that's why, as Dr. Echols said, some of these measures may seem overly stringent, but they're about protecting the health of the entire community. So we can't think about this in sort of isolated, individualistic ways. We've got to think about everyone as a potential carrier of this virus.
And the thing I would add to this is that I'm looking at the state's website right now, and these are not county or city data, but there are 47 people in the state that are under 20 that have been tested positive with COVID, and there's 139 that are age 20 to 24. Speaking to what Jason said, and those are the only ones that have been tested positive. We don't know how many are walking around with COVID, and we know there's been testing challenges. So
that's an excellent point, especially considering people can carry and transmit the disease for 2 to 14 days before showing symptoms. So there's a really long ramp up there that you could be walking around carrying and distributing the virus. Let's turn to a couple questions from email. About abundance of tests and PPE, personal protective equipment, for our healthcare workers. Dr. Echols, can you speak to that?
Sure. So there's a shortage of PPE across the nation. And so similar to what happened in Ebola, during the Ebola situation and in Zika, everyone is looking for the same resources at the same time. And so the supply is insufficient at the time for the demand. And so what we have to do is kind of wait for the manufacturers to kind of ramp up their production to meet the demand of the situation. And so I think the federal government is starting to place dollars into in places so that resources can be created or prepared for the communities that need them. And again, this is a regional issue. And so the health departments are working in collaboration with the hospital systems, academic institutions to secure resources that we need to make sure that the healthcare workers are properly prepared, as well as other individuals that are on the front line, such as our first responders and public health workers.
Can we talk a minute about hospital beds and the anticipated number of people that will need them, and whether or not we are equipped to not only deal with St. Louis residents, but many Missouri residents who live in rural Missouri where hospitals have closed because of a failure to expand Medicaid and other issues, and those folks relying on St. Louis for hospitalization.
Right, and that puts us in a very vulnerable position because we have some capacity, but that capacity really is sufficient for the St. Louis region. But when you think about those other jurisdictions outside of the St. Louis region that rely on the expertise and the medical services that are available in this region, we can reach capacity at a very short period of time. And so that there is potential for that to happen. And so again, the health departments and the health systems are working really closely together to properly plan and develop additional ways to kind of mitigate the spread of COVID-19 in our area, again, to protect, and that's necessary to protect our healthcare workforce as well as the public health workforce.
If I could, could I speak to that, Cara? Sorry.
Yes, absolutely.
So, and I echo everything that Dr. Echols said. I think the good news is that in the St. Louis region, as Dr. Echols said, we have a relatively good set of, good capacity, at least when we started this. Secondly, we are, we're not at the place where New York is right now, but don't get complacent because we're probably about a month to 6 weeks from where the peak is going to hit. That's what the modeling suggests. So all the people are planning, Dr. Echols is, the county is, the health systems are. But this point is really well taken that, there's been a lot of planning and modeling going on in the health systems. Do we have enough bed supply? Do we have enough PPE? Do we have enough workforce to be able to handle this? And it would be one thing if we were looking only at the St. Louis region, but we know because of the point you just made, Cara, that, people from around the state may be coming into the region because of the expertise of the region, because hospitals have closed. There have been, depending on how you count the numbers, 10 or so more rural hospitals have closed around the region. They don't have an unlimited bed supply. They don't have unlimited expertise. So when they hit their capacity, when they hit their expertise limits, they might start sending people to the St. Louis region. So that is a concern. Believe me, they're thinking about that. So.
Right, and some of the measures that have been implemented on the planning side is to identify those spaces that typically aren't used as patient rooms, and really making sure that those can be utilized if need be. For example, surgical suites; those can be used for patient rooms if need be. If the current infrastructure isn't sufficient to meet the demands for patients that need medical services, we may have to repurpose some of those other areas to increase their ability to provide medical care in their facility. And so those, again, a lot of thinking and a lot of planning is currently happening to make sure that if that transition is required, that it can be made in a timely and efficient manner.
I agree.
And are we looking to increase capacity beyond, we see these horror stories in New York and of Central Park becoming a makeshift hospital. Is St. Louis preparing in case we have to get to that point?
Absolutely, that's part of the planning process. So not only looking at the spaces that may be available within the current facilities that exist, but also identifying alternate sites where a temporary hospital can be stood up. And so again, a lot of planning is happening because we want to make sure that, then we want to make sure that we can provide services for those individuals that need them.
We're getting a lot of questions about our most vulnerable residents, those who can't stay home, our unhoused population. Can we talk a little bit about what kind of planning and what kind of preparedness we have for our region's homeless population?
Again, this is another major priority for the city of St. Louis and St. Louis County. And so we've identified alternate locations for individuals, particularly those individuals who may screen positive, of those individuals who need to be quarantined and can't be housed with the general homeless population. So they'll have a secure place to go while they're being monitored by the health departments. With the current housing facilities, we started working with them a couple of weeks ago as well to make sure that their cleaning practices, their hygiene practices were appropriate to minimize the potential for transmission in their facility. One challenge that other jurisdictions have had is social distancing, implementing social distancing recommendations in those facilities. Because when you start spreading beds apart, you limit their capacity to actually house individuals. And so where do you place those individuals that can now no longer be housed? So those are some of the questions that we're thinking about. But all the housing facilities in the city of St. Louis and in the county have been very cooperative, and they've been really champions for us, helping us to better understand their practices and protocols, but also understand some of the challenges that they have implementing those the recommendations, and that they're innovative ways that allows us to still, satisfy, our recommendations, but maybe not to the certain extent that other agencies are able to do. They're doing that as well. And so again, we have to think outside of the box and be flexible during this time, because again, as Dr. Purnell said, this is something that we're all we're forging together, but we're also learning together. One of the things that's highlighted during these events is not only how prepared we are, but it also highlights how unprepared we are in some circumstances. So it gives us an opportunity to really learn more about our system and how our system can be improved, but also is important for us as health departments and as health systems to document those things as we move through this situation, because we don't want to get through COVID-19 and then have something else come up within the next few years, and then we're going back to square one because we didn't learn our lesson this time. So this is a great learning opportunity for us, and we're doing our best to document those lessons learned as we navigate this situation.
And some of these questions are comments, and as well as we're all kind of learning as a community. One of the questions that just came in is about messaging and getting information out to those unhoused individuals who may not have access to traditional methods of information, TV or internet, and that sort of thing. Are we working on ways to get information out to those folks?
It's enough for the city. So we work with the continuum of care. And so I believe all of the partners within the continuum of care received the FAQ that was issued so that they could provide information to their constituents. But I believe we also linked them to CDC guidance related to that, CDC guidance related to measures that can be implemented to help protect unhoused individuals.
This may be directed at Dr. Purnell to kind of be thinking about messaging specifically to folks that have brain injuries or other issues that may inhibit their ability to take in information in traditional manners as you develop those regional communication strategies. If you wanted to speak on that or just take that in.
There are a number of those kinds of variables that we're all taking into account in terms of not just the message content itself, but the way of delivering that content. Language has been another of those issues that has come to the fore, so that we're providing information in multiple languages. We're reaching out to immigrant and refugee and undocumented communities. So those are all great considerations and considerations that are being taken into account. And and it also speaks to the need to, we've talked a lot about the physical health impact of this, but there is also a behavioral health impact to this pandemic and to this crisis. So partners like Behavioral Health Response and the Behavioral Health Network, Alive and Well communities, all thinking very seriously and deploying resources in order to respond to the behavioral health aspects of this crisis as well.
Turning a little bit to some questions we received in advance, enforcing the stay-at-home order. Is there an enforcement plan for that? Dr. Echols, can you speak to that?
So we didn't want to, the purpose wasn't to implement a militant practice, but what we really wanted to do was empower the community with education, and so that they can hold themselves and their family members and their community members accountable for adhering to those guidelines. And so forcing people to comply really can do more harm than good. And so our focus was really educating them to ensure they understood the guidance that we were given, but more importantly, making sure that they understand why we're making the decisions that we're making. Oftentimes we'll just make decisions or create policies, but no one understands why. But if you are able to get individuals to understand the why behind the decision, they can actually champion it for you. And so that was our approach, because we have really great citizens in the city of St. Louis, and we have really bright citizens in the city of St. Louis. And so we want to make sure that they have the information that they need to adhere to the recommendations, but also make sure that they understand some of the background information as it relates to decision-making for this particular situation.
If I could could I jump in on that, Cara, real quickly? We were talking a little bit about this before we got started, and I agree with Dr. Echols. This is not something we hope that we need to actually sort of enforce in a really heavy-handed way, but this is probably one of those things. One thing to say about this particular pandemic is this is a very virulent disease that really has very easy to pass from one individual to another, and the thing to understand is sort of think about this in a community sort of way, that you may not know that you have it, or you may not, you may be a young person, or whatever age you are, and the way I sort of think about it is I've had a cold for a couple of weeks and I don't know what I have, but I don't want to get around people. Especially don't want to get around a 70-year-old or 75-year-old or somebody who's got a chronic disease and make them sick, because they, what could happen to them, it's just not responsible to do that, and so that's sort of the way I think about it, and I don't want to get around my students. I don't want to get around my colleagues. Jason lives just a few blocks from me. I want to go have a cup of coffee with him. He's my buddy. He's across the hall from me. I wish I could do that, but I don't want to do that because I don't want to make him sick, because he's got some young kids and I don't want to make his kids sick. So that's kind of the way I think about it. And so I think that's the way we need to think about this for a few weeks, if that makes sense.
It does. Yeah, I mean, when talking about sort of the essential businesses and kind of going back to what is considered essential, Dr. Echols, can you speak to that?
Sure. So that was very intentional about what we designate to be essential versus non-essential. We do recognize, the economic impact that closing businesses has, and so we also were mindful of a lot of the investments that were already made in the city of St. Louis. And so we didn't want those particular projects to actually be halted, particularly if those organizations were able to implement the protocols and recommendations that we have issued.
And if I could jump in on that again, Cara, too. Sorry, I'm an economist, so I'd love to jump in on this. There's been a lot of discussion of this in the media and such. I know this economic challenge is going to be intense for people. And the way a lot of economists are thinking about this is, we really can't, we'd love to be able to just say, go to work and, just sort of, let's deal with the recession right now and just I'll just jumpstart the economy again. But, frankly, first of all, that probably wouldn't work because people are too scared. They don't want to go to work. Secondly, if they did go to work, a lot of people would get sick, and we'd have a really pretty big problem because we'd have a lot of healthcare costs, and employers would have problems and so on. And so the message that I want to give is like, we have to solve this health problem first. The way to solve the economic problem is to solve the health problem. So Dr. Echols, Dr. Spring Schmidt, the county, the state has to solve the number one way we need to solve the economic problem, solve the health problem first. Do the testing, do the prevention, make the sick people healthy. We got to get through these few weeks. The economy will turn around after that. It's going to be kind of hard. We have to protect the vulnerable people that are going to lose jobs. We have to make sure that they don't suffer too much. We got to make sure that they, get food to them. We got to make sure that they have medical care. We got to, that's, I think, a challenge that we're going to have to face. Those of us who are privileged are going to hold our jobs. I think it's incumbent on us that we think about the situation they're in. The homeless, as we talked about, the people who are going to lose their jobs. That's what we need to be thinking about, because this is going to hit them really hard.
Absolutely.
One of the questions that came in a little bit earlier was, how do we know when we can stop social distancing? How do we know when we can all go back to the world as we used to know it?
So this is a data-driven situation. So when we're making our decision, we're looking at the data to make sure we're operating in not from an emotional standpoint, but from an evidence-informed standpoint. If we're not looking at the data, we're doing it wrong. And so that's what we've been doing since day one, is looking at the data to make sure we're monitoring the situation properly. If we're identifying different pockets within different areas of the city or the county or the region that needs more attention, we have the data to support or justify the methods that we implement.
I think that's a tough question to answer. Other health problems don't disappear during a pandemic, obviously. Specifically, people with substance abuse disorder. We have a very high rate of opioid use in St. Louis and in our area. Can you talk about people that are more at risk for other health issues during this time, and what the city might be doing to support those individuals?
All right, you're absolutely right. So those other issues that we've been monitoring all along, evaluating all along, they don't go away. And actually what happens is, they're actually highlighted during these types of events. So the inequities, the disparities that currently exist at baseline become more apparent during these types of situations. And so as it relates to mental health, so mental health is a very important piece, and especially as, businesses shut down or people lose employment, those types of things, that impacts their mental health. And so the city of St. Louis, so we're looking at this from a regional standpoint as well. So we've engaged the St. Louis Mental Health Board, and they're actually convening the resources for us so that those mental health resources will be available or are available for individuals across the St. Louis area.
And I would just add that a number of our behavioral health providers are moving to telehealth options where they're able to continue to provide services using telephones or to the extent that people have access to the internet. So people are pivoting in real time to be able to continue to deliver services even in the context of social distancing.
And Dr. Purnell said, are those services available to some of our more vulnerable residents?
Yes, many of the most vulnerable are enrolled in programs who are making those adjustments as best they can. One of the stark divides that we continue to have is a digital divide in the St. Louis region. And one of the most challenging problems that we've been working on in partnership with Kristen Sorth, who runs the St. Louis County Library. She's been working doggedly to try and identify the need for hotspots and hardware. She's collected data from over 40 schools and school districts throughout the region. And there are literally tens of thousands of young people who don't have access to the internet, don't have access to the tools that they need to do some of this remote learning that schools are implementing. So as Dr. Echols said, this is just uncovering the very deep inequities and divides that we see, and people are doing their best to try and fill those. What I hope happens is that we have some wake-up calls as a result of this crisis, that we think about the way that we are distributing resources. We knew, everybody on this call knew before COVID-19 hit, that resources were not distributed equitably in the St. Louis region or across this nation, and they weren't distributed randomly either. So we have to redouble our efforts to make sure that the most vulnerable are taken care of, not just in a time of crisis, but and this, you know, this can't be underlined enough. Some of the vulnerability that we're seeing is actually going to exacerbate the spread of this virus. Some of the vulnerability that we see in terms of the unequal burden of chronic disease, for instance, in communities of color, in low-income communities, is going to exacerbate the severity, and it's going to have a differential effect because of what we know are these underlying conditions. So we've got to attend to that. I know that there's the immediate need, but in the long term, we've got to do a better job of more equitably distributing resources.
Amen.
I'll second that, or third it. And speaking of the digital divide, Dr. Purnell, we're getting a lot of questions about how the FAQs and information is being distributed to folks that don't maybe have access to the internet or the city's website or things of that nature, specifically on how specifically shut-ins, elderly people who may not have access to streams of information. Can you speak?
So there are a number of efforts to proactively reach out to those populations. Just on a call this morning with several groups who are calling seniors and calling people with disabilities and connecting with them and asking them how they're doing and checking in on them and giving them referral to resources. And we need to make that even more robust. We need to expand those efforts because some of the people who are vulnerable now may not have been vulnerable 2 weeks ago. There may have been seniors, for instance, who felt safe and fine going out to the grocery store 2 weeks ago and are afraid to do so and are taking precautions. So we have to be able to expand the reach of the people that we're reaching out to proactively in order to identify those needs, but there are a number of efforts to do so. And I will say there are also very brave community health workers and others who are going out into community to canvass. They're not just relying on digital and technological. They're doing old-fashioned hit the streets, shoe leather types of outreach, and we're very grateful for them doing that kind of work.
We're getting quite a few questions about organizations that want to participate. How does an organization get to the response team table, or how does an organization like Meals on Wheels or some of the other folks that have direct communication with some of those hard to reach folks get involved in making sure that they're utilizing their channels as well?
So we're working very hard. The initial task was to try and get some infrastructure in place so that we weren't all moving in 20 different directions, but that our activities were aligned. And now that we've got some of that infrastructure in place, we're prepared to say this regional response team is truly all of the region and a mobilization of every actor. But what's so important is that that action be coordinated. We cannot row the boat with every oar going in a different direction. And that can be hard sometimes for the St. Louis region. We have some pretty famous fragmentation. So we're trying to build some of that critical civic infrastructure, not as edicts or trying to be dictatorial, but to say, this is, as we said, an unprecedented challenge, and we're going to have to work together. And that means we need some people to lead, and we need some people to follow that lead. So the intent is always to be as inclusive as possible, but we've got to be organized.
Let's turn a little bit to the disease itself. Studies have shown that the virus can be airborne for up to 3 hours. I haven't seen that study, but I've seen many others that have said some alarming things along those lines. Some have said that it was even detected in hallways, outside of patients' rooms. Are we concerned about being outside or having our windows open?
So proper ventilation is a really important component for controlling airborne disease. So whether you think about influenza or tuberculosis, a lot of the control strategies or mitigation strategies are the same. And so some of the studies that have been released have been done in controlled environments. And so that's very different from being out in the open. And so there is some concern as it relates to how long it can stay in the air, how long it can live on surfaces. And so that's part of that's one of the reasons why we incorporate cleaning commonly touched surfaces regularly, as well as making sure that people stay at home if they're ill, so that the other people around them, and whether it's in the workplace or in a restaurant, et cetera, they aren't exposed to those infected respiratory droplets.
Can you speak to when somebody should see a healthcare professional? Specifically, I know the testing seems to have plateaued in St. Louis and Missouri, and we don't seem to have access to adequate testing. When should we be encouraging folks to go see a doctor?
Individuals should follow up their medical provider if they feel ill, if they have any symptoms that they're concerned about. They should follow with their medical provider to be evaluated, and the medical provider can determine if getting tested for COVID-19 is actually appropriate.
Do we have any concerns about the amount of testing that we may have available to us as a city, as a region? I know we work very hard to get testing sites available in North St. Louis, and I understand they receive less than 10 tests. How do we, should we be concerned about this?
Absolutely. So the lack of testing resources is problematic for not only the St. Louis region, but for the entire state, and actually for the entire nation. And so the city of St. Louis, we've been working really hard to procure additional testing supplies, particularly swabs, which the health systems are in need of, as well as viral transport kits. And so we're hoping to receive a large shipment of viral transport kits within the next couple of weeks. And those resources will be distributed across the region to ensure that we can increase access to COVID-19 testing beyond those individuals who are insured and can afford it, but to open it up to the most vulnerable populations within our region.
One of the questions is about people who have tested positive, their whereabouts, their employers, and who they are. Is this something that the city is considering sharing? There's been some comparisons recently in the news with other areas. Could you speak on that, Dr. Echols?
Absolutely. So what I can say about that, so we don't control what other jurisdictions do, but we, as a HIPAA covered entity, we are bound to adhere to the federal regulations that have been established that govern, and those regulations govern data sharing and release of public protected health information. And so as the Director of Health for the City of St. Louis, I will not violate the HIPAA regulation.
A question came in about our water supply, and should we be worried about containing COVID-19? There was some recent changes relaxing EPA guidelines and that sort of thing. Dr. Echols, would you mind speaking on that?
Sure. So that was a recent study that was published, I want to say in the New England Journal of Medicine, where they looked at different sources for COVID-19, and the water supply wasn't one of those. So our water supply is well protected. They have really strict processes in place, and so people should not have to worry about the water supply for the city of St. Louis.
Question came in about textile manufacturers locally producing masks and other healthcare items. I will say that we have some textile producers and some clothing manufacturers down here in South City that have come to the table to donate their time and efforts to help equip our community. Does anybody else want to add to that?
Sure. So for the city of St. Louis, so we work through our supply commissioner, who has been doing an amazing job securing resources for us. And so all of the vendors that are selected by the city have to be vetted. There's a process. And so they have to be properly vetted to make, because there's also a lot of gimmicks that are coming up around this time. So we have to protect the resources that we have with the city of St. Louis. And so our supply commissioner is doing an amazing job of making sure that we are able to get supplies from valid or qualified vendors.
A couple of comments that came in. Charter offering free and reduced cost internet services. Schools are trying to assist with technology. One of the questions that just came in just now was about additional space. Are we looking at we've kind of touched on that, Dr. Echols, so I don't want to beat that too much. We are looking at other spaces throughout the city and the region. That's right. Federal assistance. Do we know anything for sure that might be coming in that regard to help the city or to help businesses in our community or organizations that are working on COVID-19?
Yeah, so for the federal funds, so they're typically channeled through the state. And so we're working really closely with the state to make sure that the St. Louis region remains a priority on their list so that we can receive PPE and other needed resources in a timely manner.
I'll point out that Dr. McBride on the chat room here is encouraging people to go outside, exercise, go for walks, as long as they practice social distancing. Face masks as a physical barrier, is that something that's recommended for folks that are not experiencing symptoms?
According to the guidance that has been issued by the Centers for Disease Control, individuals that are asymptomatic should not, or they don't promote having them wear masks.
And so we're kind of adhering to that here locally. I know the question has been whether or not somebody who's asymptomatic could contain the virus while being out in the public. That's been a big national discussion recently. We're right after 8 o'clock. So I think that might be it for questions. We've had so many come in, but we have really done a good job addressing most of them. I'd like to turn it over to each of you to maybe offer some closing remarks. We'll kind of maybe go in the opposite order in which we started. Dr. Purnell, would you start us off?
I would just say that, we have some challenging days ahead of us, and we're going to have to come together as a community to really address these challenges. I'm already seeing a great deal of collaboration and coordination, and encouraged to see it. We're going to need to redouble those efforts. And I hope that everyone, as Tim mentioned, those of us who are more secure are thinking about those of us who are more vulnerable in these situations, and consider donation, consider volunteering, consider helping and contributing in ways that you can, while also adhering to the guidelines around social distancing.
Dr. McBride?
Thank you. And again, thank you, Cara, for organizing this, and Dr. Echols and your great staff for all your hard work. There's a saying that we have in public health that we talk about quite a bit, that infectious disease does not stop at Skinker. So, we're in this as a region. And, St. Louis City, St. Louis County, this has been sort of a passion of a lot of us for a long time. This is something we're going to face as a challenge, as Jason just said. I think all four of us on this call are of the same mind, that we think about the vulnerable populations in particular as this goes forward. I think be mindful that everybody in this call is thinking about this and planning for this. worrying about these issues. But, you know, the challenges are coming. Especially, you know, I worry a lot about the economic challenges that people are going to face, and how they dovetail with health challenges that people face, as Jason mentioned. So we have to be pretty mindful of that too. But, you know, I think in some ways St. Louis is a little better off than other places. I don't want to be sanguine about that. You know, St. Louis has a famous history. In the 1918 flu pandemic, Max Starkloff, the grandfather of the recently passed away great Max Starkloff, was made famous public health history in knowing how to deal with a famous pandemic of the 1918 flu. And he sort of taught us a lot about how to deal with the 1918 flu. And we're following some of those guidelines. And he had a lot of criticism for what he did, because he shut down schools, he shut down events, he shut down virtually the whole city. And St. Louis came through that flu better than most of the rest of the country. So we should, you know, I watched a couple of videos about that. There's a great one that 9 Network put out. You might want to watch that and see. We should be pretty proud of that history. And, you know, I'd like to see us be proud of how we come through this. But being proud of that means that we have to take care of ourselves and take care of our most vulnerable people. Thank you.
Thank you, Dr. McBride. I'd love to see that video. Share it maybe on one of these channels here. Dr. Echols, do you have any final thoughts?
I'm sure, again, as Tim mentioned, so thank you for providing us with this platform to get accurate information to the community at large. As we move forward, I think everyone needs to understand that our priority is saving lives. As Tim mentioned as well, you know, if saving lives have to be the #1 priority, because if we don't save lives, then there's no economic rebound. And so making sure we keep lives first, but we also want to make sure that individuals know that this is a serious situation, and we all have a role to play in preventing the spread of COVID-19 in our community. And so for everyone that has tuned into this video, we charge you to implement those simple recommendations that we issue every single day. You know, wash your hands with soap and water regularly, use hand sanitizer if soap and water aren't available, cover your mouth when you're coughing and sneezing. Most importantly as well, stay home if you're ill. Because when you go to work and you expose others, you really put the entire community, the entire region at risk, because you have individuals traveling from Illinois and other counties to actually work in the city and in the county. And so please stay home if you're ill, and seek medical care if you're feeling ill as well. And so we all have a role to play in this response, and we should hold ourselves accountable, our family members accountable, and those individuals in the community accountable, so that we can get through this successfully.
Thank you, Dr. Echols. I'll just wrap this up by saying thank you to all of you, to all of our panelists. I think it was Dr. Purnell who pointed out that many are working around the clock to serve our community, and the folks here on this panel are 3 of the folks doing just that. I know you all are incredibly busy working behind the scenes. Thank you for taking time to answer questions from the general public tonight, and thank you to everybody from the general public who was able to join in and for the thoughtful questions. We got to most of them, not all of them. I can follow up with individuals on some of those questions that we didn't get to. A special shout out to Bill Streeter of Hydraulic Pictures, who really put the technology behind making this available for us all tonight. And I'll just close this out by reiterating what Dr. Echols said there. Please stay home. I know this is painful. We all know this is painful. It's going to cost us all tremendously. People are losing their jobs. People are losing their businesses, and many people will lose their lives. We're in this together, and the more prepared and the more proactive we can be, the faster we can get to the other side. So please take this seriously. There's nothing more serious than saving lives. And please, thank you for tuning in from home tonight, and please stay home. That's it. Thank you, Bill. Thank you all for joining us. Good night.
Thank you.
Thank you.